Hi, I'm Dr. Balamurali, spine and neurosurgeon. One of the commonest questions I get asked by my patients is I suffer from pain. Should I be active or should I take rest? The first thing is you need to rule out whether you have a serious problem that has to restrict your mobility. 95% of the times, that's not the case. You can still be active because you do not have a serious problem. Most patients think that pain means that something is seriously wrong. That if there is pain, that you should not walk. And they are told by people that you should not walk, you should not drive, you should not sit, you should not bend. There's so many things that people are told because you have back pain. There are two types of people. There are one who are avoiders and the other one who are the copers. The avoiders are people who are very afraid, they're very low mood, they do not want to work, they're looking for constant solution, they depend on tablets, they're always seeking doctor's help, they're looking for a solution, and they're not active and they're afraid. The copers, on the other hand, are people who know that there is no solution to the problem. They want to get on with it. They are positive. They try to work around it. They take rest when needed and then they get on with it. They do exercise and they think positive and they are active. So there's a big difference between the two groups. The avoiders become very dependent and take a very long time, and their acute pain becomes very chronic. Whereas the copers, they do improve, they do get better, and they do find good results as time goes on, and they learn to live with the problem. Let me tell you what happens to the body and the spine in specific when you take rest and when you're active. When you take rest, the spine becomes stiff, the muscles become weak, the bones become weak, the ligaments become weak, you become very low, depressed, and you're very anxious, and nobody's there trying to help you. But when you're active, your muscles become strong, your mood is elevated, your bones become strong, your body is very active, and people around you want to support you. So, now what can you do in order to stay active? The first thing is to make sure that there is nothing serious and your doctor has given you the go ahead. Keep doing your daily routines at home and at work. Do not take time off from work. Do exercises regularly. It could be very simple and you can gradually build on it. You may have good and bad days. Keep active. Do everything that you can possibly do. Hurt does not mean harm. Keep your mood elevated. Try to divert yourself by doing multiple activities. See a psychologist if you cannot cope with your depression and your low moods. Help always is required. If you keep doing these things, the pain will be under your control. Otherwise, the pain is going to take control over you. So, staying active is the solution for a good, healthy spine. Take care of your spine and be happy.